Hi everyone, I'm Dr. Ashley Woyak at Forward Natural Medicine. Today we're going to be looking at the second most common reason, or second cause I should say, for thyroid dysfunction. So a lot of you, like we've talked about before, are having weight gain or weight loss, you're fatigued, your hair's falling out, you're having bad skin, all sorts of thyroid symptoms. You're on a medication and it's still not giving you any relief. So like we've talked about before, thyroid starts in the brain. So you have your hypothalamus, which releases thyroid-releasing hormone to your pituitary gland. That releases TSH, which you're all familiar with, a thyroid-stimulating hormone, to tell your thyroid gland to release T4 and T3. So last week in our first video, we talked about how issues with dopamine or serotonin can actually cause an issue in this pathway, shutting down your thyroid gland down here. Another big reason for thyroid dysfunction is inflammation. Inflammation will literally shut this path down. So in your hypothalamus and your pituitary gland, you have a lot of receptors for cytokines. Cytokines are pretty much inflammation markers that you'll have. So we do blood work in office that will show us if you're having increased homocysteine, C-reactive protein, fibrogen, uric acid, all of those and more inflammatory markers to see if that's stimulating these receptors to turn or shut down this pathway. So a lot of people are wondering, why would I have a lot of inflammation or these cytokine markers? What would cause those to be increased? So these are some of the most common reasons. Number one, food sensitivities. The food we're eating today is nothing like 30, 40, 50 years ago. It's genetically modified, it's hybridized. The structure of the foods are very difficult for our body to recognize as food, and instead they're thinking it's a bug or virus or something and stimulating our immune system to attack it. Hidden infections, so if you've had Epstein-Barr virus, herpes simplex virus, cytomegalovirus, and others, those can stimulate our increase in cytokines and need to be addressed. Poor blood sugar regulation, dysglycemia, that can be a big increase for cytokines. Inflammatory diet. The diet today that people are eating, the standard American diet, aka SAD, is very inflammatory. Autoimmune diseases, so obviously Hashimoto's or Graves', that can stimulate this, but also other autoimmune diseases. So that's something we look at, all of these in our office. There's a lot more that we'll be discussing. Thank you. I'm Dr. Ashley Woyak.